Why does someone go to bed looking completely fine and never wake up the next morning? Why does a man laughing with his friends on a football field suddenly collapse in the middle of the game? People often call it a hidden heart problem, but the truth is more uncomfortable than that. In medicine, there is no magical invisible killer called a hidden heart. What usually exists are ignored warning signs, silent artery damage, and blood test results that were trying to tell the story long before disaster struck. And that's exactly what makes this so dangerous. Most people think a heart attack or stroke happens out of nowhere. But in reality, the body often sends signals for months or even years before the emergency happens. The problem is that almost nobody knows how to read them. Your body usually whispers before it screams. A blocked artery rarely starts with dramatic movie-style chest pain. Sometimes it begins with pressure in your chest while climbing stairs. Sometimes it's a strange burning sensation you blame on indigestion. Sometimes it's leg pain while walking that disappears after resting. Sometimes it's dizziness, short episodes of blurry vision, or a moment where your balance feels off for no clear reason. These things seem small, so people ignore them. But they are not random. They can be early alarms. If the blockage is in the heart arteries, you may feel heaviness, tightness, burning, or shortness of breath during effort. If it's in the leg arteries, your muscles may start hurting because they are not getting enough oxygen. If the carotid arteries in the neck are involved, you may notice strange neurological warnings like temporary vision loss, weakness, or confusion. The body often tells the truth long before the scans do. One of the biggest mistakes people make is looking at blood test numbers one by one without understanding the bigger picture. They glance at cholesterol, maybe blood sugar, maybe triglycerides, and if nothing looks extremely scary, they move on. But cardiovascular risk is not always about one bad number. It's about patterns. It's about what your blood is quietly revealing over time. A person can look mostly normal on paper and still be slowly developing dangerous metabolic and vascular damage. That is why some people in their 30s or 40s suffer serious heart or circulation problems while others seem fine much later in life. The body doesn't always wait for old age to collapse. And here's the deeper truth most people miss. Cholesterol is only part of the story. Inflammation is often the real fire. Think of your arteries like smooth tunnels. When inflammation keeps irritating the inner wall, the body starts repairing tiny injuries over and over again. That's when plaque can begin to form. Over time, that plaque can grow, harden, crack, or suddenly rupture. And when that happens, the body may form a clot that blocks blood flow in seconds. That clot can hit the heart, the brain, the legs, or anywhere else. That's when people call it sudden. But biologically, it was never sudden. It was building quietly in the background the entire time. This is also why severe circulation problems are not just an old person disease. Many younger people think they are protected by age. They are not. Smoking, poor diet, insulin resistance, chronic stress, lack of movement, and constant inflammation can damage blood vessels far earlier than most people realize. There are people in their 20s and 30s who develop such severe vascular damage that blood flow to the fingers, toes, or feet becomes critically reduced. Tissue begins to die. Pain becomes unbearable. In extreme cases, body parts can literally be lost because the blood supply failed. That sounds shocking, because it is. But it is also real. Now here's where a lot of people get falsely reassured. They think if they take a pill or if one number improves, the danger is gone. But lowering a lab value does not automatically mean the root problem has been solved. If the body is still inflamed, if insulin resistance is still present, if blood pressure is uncontrolled, if smoking continues, if sleep is poor and movement is low, then the damage may still be progressing underneath the surface. A normal-looking number can sometimes hide a very unhealthy system. That's why prevention is not just about treatment. It's about understanding what keeps arteries healthy in the first place. Daily walking is one of the most underrated cardiovascular tools on earth. Something as simple as 30 minutes of brisk walking can improve circulation, insulin sensitivity, blood pressure, and vascular function. Food matters too. Your arteries do not like constant assaults from ultra-processed foods, trans fats, excessive sugar, and inflammatory eating patterns. They respond much better to real food, olive oil, vegetables, fiber, nuts, seeds, berries, fermented foods, and balanced protein. And if you smoke, this part needs to be brutally clear. There is no supplement, no tea, no shortcut, and no healthy lifestyle trick that fully cancels out what smoking is doing to your blood vessels. The tragedy is that most people don't ignore symptoms because they're careless. They ignore them because they're busy, because they're scared, because they don't want to know. because they keep telling themselves, "It's probably nothing." But that sentence has destroyed countless lives. The chest tightness gets ignored. The leg pain gets normalized. The dizziness gets blamed on stress. The blood test gets folded and thrown into a drawer. And the body keeps warning in silence until one day it doesn't warn anymore. That is why this matters so much. Your blood test is not just a boring piece of paper. It can be a warning map. Your symptoms are not always random. They can be clues. Your body is often far more honest than your excuses. The real danger is not always the disease itself. The real danger is delay. So if you've had strange symptoms, don't keep gambling with them. If you have blood work sitting around, don't ignore it. If someone in your family always says, "I'm fine, it's nothing," show them this. Because sometimes what people call bad luck is actually years of missed warnings finally collecting their price. Your heart does not come with a backup. Your arteries don't give unlimited second chances. But your body often does give early signs. The question is whether you'll listen while there's still time.